Hey everyone, welcome to Canadian Nurse Expert. Today we're diving deep into the world of deep vein thrombosis, or DVT. We're going through 15 multiple-choice questions, each designed to challenge your understanding of this potentially serious condition. Don't worry if you miss a few, that's what the explanations are for. We're going to break down the why behind the answers, giving you a solid foundation in DVT. Whether you're a future healthcare hero, a seasoned medical pro, or just someone who likes to stay informed, this quiz is for you. So grab your thinking caps, get ready to test your knowledge, and let's see how you do. Are you up for the challenge? Hit that play button and let's get started. All right, let's jump right in with our first question. When it comes to DVT, early detection is key. So what is the most common symptom you should be on the lookout for? Is it A, shortness of breath, B, chest pain, C, swelling in one leg, or D, unexplained weight loss? Take a moment to think about it. Remember, we're looking for the most common symptom. The answer is swelling in one leg. Now let's break down why. DVT occurs when a blood clot or thrombus forms in a deep vein, most commonly in the legs. This clot partially or completely blocks blood flow, leading to fluid buildup and that telltale swelling. While shortness of breath and chest pain can occur if the clot breaks free and travels to the lungs, that's a pulmonary embolism, a serious complication of DVT. They're not as common as localized swelling in the initial stages. So keep an eye out for any unusual swelling in your legs and don't hesitate to seek medical attention if you notice it. Okay, question number 2. We suspect a patient might have DVT. What's the go-to diagnostic test to confirm our suspicions? Is it A, a routine blood count, B, an X-ray of the affected limb, C, a duplex ultrasound, or D, an MRI scan? Think carefully. We're looking for the most commonly used test for DVT confirmation, and the answer is a duplex ultrasound. Here's why. A duplex ultrasound is a safe, non-invasive, and highly effective imaging technique. It uses sound waves to create pictures of the veins in your legs, allowing doctors to visualize blood flow and identify any blockages caused by clots. While other imaging tests like MRI can provide detailed images, a duplex ultrasound strikes the perfect balance between accuracy, cost-effectiveness, and ease of access, making it the preferred diagnostic tool for DVT. It's quick, painless, and provides the information we need to make a diagnosis and get our patients on the right treatment plan. Let's talk about Virchow's triad. Sounds intimidating, right? It's actually pretty straightforward. Think of it as the three musketeers of clot formation. First, venous stasis, slow blood flow, like a traffic jam in your veins. Slow blood flow increases clot risk. Next, endothelial damage, a scratch inside your vessel. Damage triggers clotting. Lastly, hypercoagulability, blood more likely to clot, due to genetics, medications, or dehydration. These factors often work together, increasing your risk of DVT. Be aware of all risk factors. Remember the three musketeers: stasis, damage, and hypercoagulability. What happens if a clot breaks free and travels through the bloodstream? This can get really serious. It's called a pulmonary embolism, or PE, a life-threatening complication of DVT. A clot breaks off, travels to your lungs, and blocks blood flow. You need those lungs to get oxygen to your body. Symptoms include shortness of breath, chest pain, rapid heart rate, and even coughing up blood. Seek immediate medical attention if you have these symptoms. Time is crucial in treating a PE. The sooner it's treated, the better the outcome. DVT can be silent, but its complications are loud and life-threatening. Stay informed and stay safe. Let's talk about some simple things you can do to manage the symptoms of DVT. And one of them is surprisingly easy elevation. Yep, that's right. Sometimes the simplest solutions are the most effective. Remember how we talked about venous stasis, that sluggish blood flow in your veins? Well, elevating your leg helps combat that by using gravity to your advantage. When you elevate your leg above your heart, it's like giving your blood a little downhill assist, helping it flow more easily back up to your heart. This simple act of elevation can make a big difference in reducing swelling and discomfort associated with DVT. It's like giving your legs a break from working so hard to pump blood against gravity. So, how do you do it? It's easy. When you're sitting or lying down, prop your leg up on some pillows or a footrest, making sure it's raised above the level of your heart. You don't have to do this all day long, but aiming for a few short periods of elevation throughout the day can really help. All right, moving on to question number 6. What class of medication is primarily used to prevent clot propagation in DVT? So we've got this clot, it's causing trouble. We need to stop it from getting bigger, right? This is where anticoagulants come in. These medications, sometimes called blood thinners, don't actually thin your blood. Instead, they work by interrupting the clotting process, preventing that clot from growing larger and causing more problems. Two common types you might hear about are heparin and warfarin. Heparin usually acts fast, often given intravenously in the hospital. Warfarin is taken orally, and it takes a bit longer to kick in. Choosing the right anticoagulant and the right dosage depends on your specific situation, so always talk to your doctor about what's best for you. Remember, these medications are crucial in managing DVT and preventing serious complications. Let's dive into question number 7. Which test is commonly used to evaluate clotting activity in suspected DVT? Now, when we suspect DVT, we need a way to see what's happening with your blood's clotting action. One tool we use is the D-dimer test. This blood test measures the level of D-dimer, a substance released into your blood when a blood clot breaks down. Think of it like this. Imagine a construction site where a building is being demolished. The rubble and debris from that demolition are like D-dimer in your blood. They indicate that something is being broken down. Elevated D-dimer levels can suggest the presence of a clot. Now, it's not a foolproof test, as other factors can elevate D-dimer, but it's a helpful piece of the puzzle when diagnosing DVT, especially when combined with your medical history and physical exam. Time for question 8. Why is mobility important in DVT prevention? We spend a lot of time sitting these days, at desks, in cars, on planes. But did you know that all that sitting can actually increase your risk of DVT? It all comes down to blood flow. When you're immobile for long periods, your blood flow slows down, particularly in your legs. This sluggish flow, called venous stasis, creates an environment where clots are more likely to form. That's why moving around is so important. Even small movements, like wiggling your toes, flexing your ankles, or taking short walks, can make a big difference. These actions help to keep your blood flowing, preventing that dangerous stagnation. So, whether you're at work, traveling, or relaxing at home, remember to get up and move regularly. Your legs will thank you for it. Alright, question number 9. Let's talk about something called Hohmann's sign. You might have heard of this one. It's when you flex your foot upwards and feel pain in your calf. Now, some folks think this automatically means DVT. But here's the thing, guys. While Hohmann's sign can sometimes be present in DVT, it's not a very reliable indicator. Lots of other things can cause calf pain with dorsiflexion, like a muscle strain or even just tight calves. So, if you're experiencing this, don't panic, but definitely don't ignore it either. Get yourself checked out by a healthcare professional to figure out what's really going on. Remember, early detection is key when it comes to DVT. Don't mess around with your health. Question 10 is all about prevention. We love a proactive approach to health, right? So what can you do to lower your risk of developing DVT? Well, a lot of it comes down to lifestyle choices. First and foremost, stay active. I can't stress this enough. Regular exercise keeps your blood flowing smoothly, which helps prevent those pesky clots from forming. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Next up, hydration is key. Make sure you're drinking plenty of water throughout the day. When you're dehydrated, your blood gets thicker, making it easier for clots to form. And last but not least, if you smoke, quit. Smoking damages your blood vessels and increases your risk of clotting. Let's talk about compression stockings. You know, those snug-fitting socks that go all the way up your calves or even higher. Question 11 asks why we use them in DVT management. Well, think of compression stockings as a gentle hug for your legs. They work by applying pressure to your lower legs, which helps squeeze the veins and improve blood flow back up to the heart. This can be super helpful in preventing swelling and discomfort associated with DVT. Plus, they can also help prevent the formation of new clots. Now, it's important to note that compression stockings are not a one-size-fits-all solution. You need to make sure you get the right size and compression level for your needs. So if your doctor recommends compression stockings, don't hesitate to ask them about the best type for you and how to wear them properly. Remember, we want to give those veins the best support possible. Alright, let's talk about who's most likely to develop DVT. It's crucial to understand the risk factors so we can be proactive about prevention. First up, we've got immobility. Think long flights, bed rest after surgery, or even just sitting for extended periods. When you're immobile, your blood flow slows down, increasing the risk of clots forming. Next, we have patients undergoing surgery, especially orthopedic procedures. Surgery can cause trauma to blood vessels and often leads to reduced mobility during recovery, both of which increase DVT risk. Individuals battling cancer are also at a higher risk. Cancer itself can make the blood more prone to clotting, and chemotherapy can further increase the risk. Lastly, let's not forget about pregnant women. Pregnancy increases pressure on veins in the legs and pelvis, plus hormonal changes can make the blood more likely to clot. Remember, these are just some of the major risk factors. It's always best to talk to your doctor, especially if you have any concerns or a family history of DVT. Early detection and prevention are key. Now, for those of you who are prescribed warfarin to manage DVT, listen up. Warfarin is an effective blood thinner, but it requires careful monitoring. What monitoring is needed for patients on warfarin therapy? Specifically, we're talking about something called INR, which stands for International Normalized Ratio. INR is a measure of how long it takes your blood to clot. We need to make sure it's within a specific therapeutic range. Not too high, not too low. Too high and you risk excessive bleeding. Too low and the medication might not be effective in preventing further clots. That's why regular blood tests are crucial when you're on warfarin. Your doctor will determine the frequency of these tests based on your individual needs and how well your INR is regulated. It's super important to keep these appointments and follow your doctor's instructions closely. Remember, managing DVT is a team effort. By staying informed, being proactive, and working closely with your healthcare provider, you can effectively manage your condition and minimize risks. Stay tuned for our next chapter. All right, let's tackle question 14. This one's about a condition called post-thrombotic syndrome, or PTS. Now, even after successfully treating a DVT, some people experience lingering effects in the affected leg. Imagine dealing with the aftermath of a DVT long after you thought it was gone. What is post-thrombotic syndrome, PTS? PTS can be a real pain, both literally and figuratively. We're talking about persistent symptoms like swelling, pain, a feeling of heaviness, even skin changes like discoloration or ulcers. It's like your body is reminding you of the DVT long after it's healed. So, what causes PTS? Well, it's often due to lasting damage to the valves in the veins. Remember, those valves are crucial for proper blood flow back to the heart. When they're damaged, blood can pool in the legs, leading to those uncomfortable and sometimes painful symptoms. The good news is that not everyone who has a DVT will develop PTS. And there are things you can do to lower your risk, like wearing compression stockings and staying active. If you're experiencing any of these symptoms after a DVT, don't hesitate to reach out to your doctor. Early intervention is key. On to question 15, which is all about preventing those pesky blood clots from coming back. Once you've had a DVT, it's understandable to be concerned about a recurrence. But the good news is that there are steps you can take to significantly reduce that risk. What should patients know about preventing DVT recurrence? First and foremost, if you're on blood thinners, also known as anticoagulants, adherence to your medication regimen is crucial. These medications help prevent clot formation, so consistency is key. Your doctor will determine the right type and dosage for you. Next up, let's talk lifestyle modifications. We're talking about maintaining a healthy weight, staying active, and kicking those unhealthy habits like smoking to the curb. These changes not only reduce your DVT risk, but also benefit your overall health. Remember, knowledge is power when it comes to DVT prevention. Stay informed, stay proactive, and don't hesitate to reach out to your healthcare provider with any questions or concerns. Your health is worth it. That wraps up our DVT quiz. How did you score? Let us know in the comments. We covered a lot of ground today, from symptoms and diagnosis to treatment and prevention. Remember, DVT is a serious condition, but with awareness and early intervention, we can effectively manage it and reduce its impact. Don't forget to like, share, and subscribe for more medical quizzes and insights. See you next time.